Hello, my name is Susan Blank, and I'm a doctor who works with the Virginia Department of Health. Thank you very much for joining me for this learning session, which is part of the Virginia Healthy Hearts Initiative. Today, we're going to be talking about how to check your blood pressure at home. Monitoring your blood pressure at home can be a wonderful tool for taking control of your blood pressure and improving your heart health. So I'm very excited that you're here to learn more about it. Let's get started. We're going to start by discussing the benefits of home monitoring, then move on to talk briefly about how to interpret blood pressure readings. We'll spend the majority of our time discussing how to check the blood pressure, and then we'll finish up by discussing the impact of some common pitfalls on blood pressure readings. High blood pressure is a #1 controllable risk factor for heart attacks and strokes. Sometimes it's called the silent killer because it can cause a lot of damage to the heart and blood vessels without causing much in the way of symptoms until someone has a catastrophic event. And it's a huge problem in the United States and around the world. In the US, nearly 1 in 2 adults have high blood pressure, but unfortunately, only 1 in 5 of those adults with high blood pressure will have their blood pressure adequately controlled. And that means that there are a lot of people out there with ongoing damage to their heart and blood vessels because of high blood pressure. Home blood pressure monitoring provides a very helpful tool to get and keep your blood pressure under good control. It allows you to know your numbers. The first step in getting anything under control is to measure it, and home blood pressure readings are especially helpful because instead of getting a single snapshot in time like you do at the doctor's office, you're able to check your blood pressures more frequently and in the course of your day-to-day life, and that gives a better overall picture of your blood pressure control. Once you know those numbers, you can communicate them with your healthcare provider and work with them to get your blood pressure under control. Home blood pressure monitoring allows for more frequent adjustments in your medications if needed, and people who are checking their blood pressure at home can get their blood pressure under control more quickly and with fewer doctor's visits than people who are only having their blood pressure checked at the doctor's office. And if you're able to lower your blood pressure, you can improve your cardiovascular health and lower your risk of heart attack and stroke. Now we're going to talk for a minute about how to interpret your blood pressure readings. The blood pressure is made up of 2 numbers. The top number is called the systolic blood pressure, and the bottom number is called the diastolic blood pressure. The systolic reading reflects the pressure in the arteries when the heart is contracting, and the diastolic reading reflects the pressure in your arteries when the heart is relaxed. And the blood pressure readings can fall into a few different categories. If the blood pressure number on the top is less than 120 and the number on the bottom is less than 80, that's considered normal blood pressure. If the systolic reading or the reading on the top falls between 120 and 129, and the bottom number or diastolic is less than 80, that's considered elevated blood pressure. And if the top number is 130 or above, or the bottom number, the diastolic, is 80 or above, that's considered high blood pressure or hypertension. It's important to know that if you ever get a blood pressure reading where the top number is over 180 or the bottom number is over 120, that can be a medical emergency. If you're having any symptoms, you should call 911 and get emergency care immediately. Some concerning symptoms would include chest pain, shortness of breath, severe headaches, vision changes, numbness, and weakness. Even if you're not having any symptoms, it's something to take very seriously. You should sit quietly for a couple minutes and then recheck your blood pressure. If it's still elevated with a top number over 180 or the bottom number over 120, you should call your primary care provider and get some guidance immediately. Now we're going to move on and talk about how to check your blood pressure. And the first step in getting an accurate blood pressure reading is to make sure that you have the right equipment. Many insurance companies will cover home monitoring devices for people who have high blood pressure and a doctor's prescription. You want to choose an upper arm device, not a wrist or finger device, because the upper arm devices are more accurate. It's also really important that you use a validated device. And the American Medical Association has a very helpful website, which I've listed here, called validatebp.org, which lists all the devices that meet their quality and accuracy standards. The next step is to make sure that you're using the correct size cuff for your arm. If you're using too small a cuff, it can lead to blood pressure readings that are artificially high. And if you're using too big a cuff, it can lead to readings that are artificially low. And to do this, there are a couple different ways. The first is that you can measure your arm circumference and then look at a chart to choose the correct size cuff. To do this, you'll want to get a tape measure and wrap it around your arm, around midway between the shoulder and the elbow. Once you get that reading, you can refer to a chart like the one that I have here, and it can tell you whether you can just get a regular adult size cuff or if perhaps you might need one that's smaller or larger. And charts like this are often printed on the sides of device boxes if you're looking at them in the store, or on the internet site if you're buying a device online. If you already have a cuff and you want to make sure that it's the appropriate size, you can do that by looking at some of the lines that are on the cuff. There's one called the index line, and there's another set called range lines. If you put the cuff on your arm and the index line falls within the range lines, you're good to go. That's the right size cuff. If the index line falls on this side of the range and you have a bunch of the cuff left over, that means the cuff is too big and you need to size down. If the index line falls over here and you just have a little bit of the cuff left over, that means that the device is too small and you need to size up. Once you have the right equipment, you want to select the right environment to check your blood pressure. You want to look for a quiet area where you can relax. You need a chair with a supportive back, and you want a table or a desk with a flat surface where you can support your arm at chest height. There are a few things that you'll need to do in preparation for checking your blood pressure. For about 30 minutes before you check your blood pressure, you want to avoid caffeine, alcohol, smoking, exercise, and eating. These are all things that can influence your blood pressure. For example, if you have a cup of coffee before you check your blood pressure, it could add 5 to 8 points to the systolic reading, or that top number of your blood pressure. This can be a little tricky, so a lot of people find that it's easiest to check their blood pressure first thing in the morning or close to bedtime. You also want to take a bathroom break and empty your bladder if you need it. If you have a full bladder, it sends signals to your brain, which can result in blood pressure elevation and raise your systolic blood pressure about 10 points. In order to place a cuff correctly, you want to start with a bare arm, and the cuff should be placed on the upper arm with the bottom edge of the cuff approximately 1 inch above the elbow crease. The artery index line or marker should line up with the brachial artery, and the brachial artery is drawn into this diagram. You can see it runs right down the center of the inner arm. The artery index marker often looks like this. It will be a line with a little arrow at the end, and on some cuffs it looks more like this. It will be a circle with a line through it. And the fit on the cuff around your arm should be snug but not tight. When the cuff is deflated, you should still be able to fit 2 fingers between the cuff and your arm. Proper positioning is also really important. You want to be sitting in a chair with your back supported. If you're just sitting up straight on your own, you're turning on some muscles in your back and in your core that can raise your blood pressure. You want your legs to be uncrossed with both feet flat on the floor, and you want your arms supported on a flat surface with the palm facing up, and the cuff should be at mid-chest level, which is approximately the level of your heart. Once you have your cuff and yourself in the appropriate position, you want to rest quietly for about 5 minutes without any distractions. So no talking or texting or scrolling or looking at anything that might raise your blood pressure. Skipping this step can add around 10 to 20 points to your systolic blood pressure. It's especially important that you sit quietly and do not talk before and during the actual measurement of the blood pressure reading when the cuff is being inflated. When you're ready, you want to press start on your device. The cuff will inflate and then gradually deflate. When you see a number, you want to write that blood pressure down on a notebook or log, and then rest for 1 to 2 minutes with the cuff deflated and repeat so that you can get multiple readings and average them. Here's an example of a blood pressure log. This particular one can be found on the VDH website, and I'll have the address for that website at the end in case you want to access it and print it out. But you can also write the same information down in a notebook. The information that you're going to want to include is the date and time of the reading. You want to write down the actual readings, and then you can include notes about anything that might be influencing your blood pressure that day. So if you had accidentally had some coffee that morning or had a particularly stressful day at work, those might be the kinds of things that you want to note. Once you've gathered all the information, you want to bring the log of the blood pressures into your appointments with your healthcare provider. Some providers may also want you to communicate with them about the readings between visits. If your blood pressure is ever consistently elevated over your target range, you want to let your healthcare provider know so that they can adjust your medications if needed. A good target for most people is to keep the top reading under 130 and the bottom number under 80, but it is individual and depends on your age and other health care factors, so talk to your provider about what the right target is for you. It's a good idea to consider bringing your home device into the office approximately once a year, so the reading that you're getting on it can be compared against the reading in the office to make sure that it's accurate. It can be very tempting to skip some of these steps, but they all are really important for getting an accurate blood pressure reading. And this diagram looks at the potential impact of skipping some of these steps. So if you are talking or even just actively listening while your blood pressure is being taken, that can add 10 points to the systolic blood pressure or the top number of the blood pressure. If you use a cuff that's too small, that can add up to 10 points. Putting a cuff on over clothes, depending on how thick or bulky the clothes are, can have a tremendous impact. It can add up to 50 points. An arm that is unsupported can add 10 points. Legs that are crossed can add between 2 and 8 points. Unsupported back or feet can add 6 points, and a full bladder can add 10 points. So you can see that if you fail to follow the appropriate steps, you can end up with a blood pressure reading, which is much higher than it really should be. This concludes today's session. Thank you very much for your time and attention. I hope you've learned some helpful tips for checking your blood pressure at home and feel ready to take control of your blood pressure and improve your heart health. If you're interested in the blood pressure log that I showed you or additional information about high blood pressure or heart disease, I've included the address for the VDH website along with a QR code that will take you there. Thank you very much and have a good day.